So agenda of the today's webinar is we are starting with the corporate presentation of Manorama, and then we will start with the webinar topic, and at the end we have the question and answer session. So I am starting with the webinar corporate presentation of Manorama.
Manorama Infosolutions is a pioneer in healthcare IT, providing enterprise solutions globally. We offer solutions for public health, corporate hospitals and medical centers on the global front. 2002. We have started as research and development in healthcare solution. 2004. After doing domain understanding and research, we have launched our first product, Clinic Desk Soft. 2006. In this year we have launched our Lifeline suite for corporate hospitals. 2009. Launched Lifeline Diagnostic, which is a powerful tool to digitalize the pathology and radiology functions of diagnostic centers. 2012. Started working with well-known hospitals across the globe. 2013. We have launched Lifeline eClinic, which is a web-based software designed for mid-size and large healthcare organizations, including hospitals, clinics and government health projects. 2014. We have developed mobile app, which is Lifeline M Health, provide physicians connectivity and quick access to patient data. Launched Lifeline Telemedicine, which is used to provide clinical health care from a remote location. 2015. In 2015 we have specialized DMRs, such as cardiac, oncology, gynecology, orthopedic, neurology, urology, and Ayurveda. 2016. We have launched our Lifeline Enterprise solution. Along with this we have developed Cloud HIMS application for Indian government. 2017. We have started working on big data analysis for health data science. In the international scenario, Manorama has implemented Lifeline ERP at 1,000 plus live sites overseas. There are two ways to spread the light: be a candle or be a mirror that reflects it. Mrs. Ashvini Danagond chose to be a candle. Her work is a brilliance that shows us that how it is better to inspire and to instruct. As a CEO and Executive Director of Manorama's Infosolutions, Mrs. Ashvini has proven without a doubt the power of vision and the sincerity of purpose. Today her company is a leader in healthcare information technology with clients both from India and overseas. To cater for the increasing customer base, Manorama has to establish offices at multiple locations. We are one of the few companies who have established solutions for 3 international governments, South Africa, Kuwait and Kenya, understanding the regional requirements at every site. We have achieved a total customer base of 560 plus installations in India and 1,000 plus locations supported in the international market. We are Microsoft Gold Partner, Gartner Strategic Partner for Advisory Services, NASSCOM Certified Member, compliant with CMMI Level 3, STS member in the non-physician category, ISO certified company by the TÜV-SÜD Asia. Lifeline Suite, a comprehensive and integrated Windows-based ERP for hospital management solution. Our systems have been designed keeping in mind all facets of the healthcare spectrum, from primary care to super specialty services. Lifeline Enterprise. These solutions enable connectivity among various locations and branches, offering consolidation of data, interoperability of systems, integration of machines, resulting in a real-time presentation of big data for healthcare. Our HIMS is a web, cloud-based end-to-end enterprise solution. Lifeline EMR, EHR. We have specialized DMRs such as cardiac, oncology, gynecology, orthopedic, neurology, urology, and Ayurveda. Lifeline mHealth. It is a mobile app allows doctors and healthcare professionals to collaborate and take accurate and timely decisions for patient treatment plans and care. Lifeline eClaim. It takes care of entire healthcare revenue cycle process, including everything from determining patient eligibility, collecting their copay, coding claims correctly, tracking claims, collecting payments and following up on denied claims. Lifeline Patient Portal. Online appointment portal links various hospitals' branches for online registration and appointment system through Hospital Management Information System. Lifeline Cardioscience. It is an application having an ability to serve a physician with all required patient characteristics, cardiac symptoms, diagnosis, risk factors with extensive score grids. Lifeline Telemedicine. It can be use of telecommunication and information technology to provide clinical health care from remote locations.
Manorama's project with Telemedicine South Africa. Dr. Lynette Mortlomofi is a South African medical doctor. She served as Director for Telemedicine Research at the Medical Research Council, MRC, of South Africa for 7 years. Telemedicine Africa has been funded by the Industrial Development Corporation, IDC, to establish a world-class virtual hospital to provide medical services to the underserviced population of Africa. Initially, specialized services in radiology, dermatology and cardiology will be available. As the sites and the demand increase, so will the specialties. The Virtual Telehealth Center. Telemedicine Africa is responsible for the virtual hospital equipment setup, facility preparation, in partnership with Dimension Data, project management, ongoing support and maintenance and the management of the platform. Telemedicine centers in Limpopo. Lifeline Telemedicine is web-based and hence, could be accessed from any platform. The application has a patient's appointment scheduler for the receptionist, an electronic medical record, EMR, teleconferencing of remote patient and the specialist, clinical investigation device integration, e-prescription and a billing system.
Lifeline Cardioscience. Project details. The Chest Diseases Hospital is a 320-bed facility for the Ministry of Health in Kuwait. The cardiology department required Society of Thoracic Surgeons, SDS, version upgradable electronic medical record, EMR. Data needed to be uploaded to adult cardiac surgery database, in the National Repository, only accessible to few. Let's check out the solution provided. Provided cardiac EMR with ICD codes, E and M calculator and risk calculator, the Euro score and the cardiothoracic surgery for operatives expertise. The data structures are designed using STS National Database version 2.81. Benefits. Controls or monitors the patient clinical and surgical information all along the complete patient care workflow. Hence saves tremendous amount of workload for the hospital. First Indian solution company to get access to add into the National Repository. Procurement, implementation, post-implementation and hospital management information system. MCGM network comprises of 3 major hospital, 5 specialty hospital, 183 health posts and 1 dental clinic, 161 dispensaries, 18 peripheral hospitals, 28 maternity homes. The total capacity is approximately 13,000 beds, which amount to 28% of the total bed capacity in Mumbai. Approximately 54,000 outpatients are treated every day at MCGM health facilities. Manorama team is all geared up to provide the complete software, implementation and training to the various locations in a planned and automated manner, making the project a big success. Our innovation. Lab-in-Bag solution, in the form of an app, integrated with iStat analyzer devices proposed to be used in rural locations where the patient coming from various locations, villages will walk to the PHC and have a test done within minutes. It comes with a single-use test cartridge that can be used to run various kinds of tests in one go. The analyzer sends the test's results wirelessly to a doctor for diagnosis. It can also store the information directly into the patient's EMR. The test results shall be viewed by a doctor, specialist and treatment suggested.
Yes, so today's topic basically focuses on the fact that how to use our technology for better patient outcome and effective care. What we understand when a patient walks in, it is very important how he feels when he first gets into the hospital. Of course, this is beyond what he's already feeling. He's not well, so we should try to make him more comfortable. So there are three factors basically when we look at what is important to see that we have a increased patient outcome in the hospital or in the facility: the clinical effectiveness, the patient experience, and the safety. So all these parameters, these three parameters would impact the result or how the patient will want to come back to the facility. On the left hand side, we are stating the parameters that help the patient feel have a good patient experience. For example, if there is a patient portal available on his mobile, he will be comfortable taking an online appointment before he actually visits the hospital. Similarly, the doctor can have the list of OPD available on his handheld, which will of course give him more comfort and will be able to schedule his appointments accordingly and make sure that he is not late for his appointments or is not in position or does not need to cancel any appointments because he has it everything on his handheld. And at the end of it, the management, they would always be happy. All the doctors sitting together will be happy to have a clinical analytics on the type of patients they've seen through all their for that week, for that month, for that locality. So those kind of analytics will of course give a good feel to the management too. In terms of patient experience, what do we mean by patient experience? So this is some specific aspects of treatment. So he should feel good about the clinical treatment that has been given. He should see the result in himself so that he feels that okay, this is the place that I got better, and that's why he feels good about the place. Patient satisfaction, it can be small things like in place of the environment, the care the nurse has given him, how good the people were to him. So these small parameters also will add on to his satisfaction level. And of course you can have a rating system, so you can judge on your own where the patient was uncomfortable, where he was very happy with a particular nurse or doctor or kind of facility to give him, the kind of bed what was allocated to him. So we should have a rating system for that, and then of course take care of that rating system and come up with different measures or procedures to take care of the experience. On the patient portal side, you can see the different positive or the advantages of having a patient portal in place, and my co-host here will show you a few of those designs that we have for our patient portal. But basically you can see these are the points listed which can emphasize why it is important to be have a patient portal available on your websites, on the hospital sites. First of all, it will reduce the incidence of no-shows. So people are comfortable taking an appointment, rescheduling the appointment on the portal itself instead of, and of course when you get the reminders, they will be more aware or alert about their appointments, and of course no one would like to miss an appointment. So it will always help to do it through a portal. It improves the patient engagement, point number 2, which means that They feel more in touch with the doctor, in touch with the facility, talking to the nurse. So they're actively involved, and there is more efficiency in the whole process of administration, because the portal will give inputs from the patient, which the administrative staff can also take care of. So how we want portal, we will discuss that in detail in future. But pertaining to this event or this webinar, let's only discuss how it helps to maintain a patient portal on your website. Point number 4, there's always improved communication. There are instant messages that can be sent from the physician to the patient, and he can also communicate similarly. There will be an improvement in the patient payments because they would do that online. You can always keep track of who got logged in and what activity they did on the portal, which will also promote your facilities, and it will of course attract new business because you will be promoting that on the website. So this is the actual scenario which a patient would come across. So let me pass you to my co-host Prabhat. He will show you a few slides of the patient portal.
Thank you. So here already Shweta has explained you about the patient's experience and how we can improve the patient's care at the hospital. So this is an image wherein patient is thinking of taking an appointment, wherein he can see the first thing he will check is the date, on which date he can go for appointment at time. So what is the exact expectation from the patients? To working with one of the well-known hospitals across the globe, we have done a couple of surveys on hospitals wherein we have asked them about how's their experience with the patient care. So they have come up with a requirement wherein they are looking forward to develop a system or application wherein patient can go and log in and take an appointment online. He can schedule appointment as per his availability. Once the appointment has been scheduled, he can get the SMS and the email for the confirmation as per the availability of the specialty doctors. So let me show you the actual patient portal, how it looks like. So this is what the patient portal dashboard is, wherein on the left hand side here you can see the patient has been already logged in. So for a demo purpose we have created this login. So on this page you can see the details of the patients, and the left hand side there are options which are available. His appointment. Once you click on the appointment, it will ask you the appointment details, wherein you can select the branch. So if you have the multi-branch facility at your clinic, you can use this application. For department, you can select the physician, preferred date, time, address, and the details. So at the time of taking an appointment, if the patient wants to make any notes about why he is taking the appointment, if it is a follow-up appointment or it is a fresh, so that information will be captured in this text box. So here we have given the functionality, we have given the features where billing, wherein patient can pay his bill online, his EMR details, wherein patient can see his EMR details like his previous EMR details, his prescription details, and his medical records. So as a point of our hospital's marketing point of view, so what we have done is here we have given the details of the hospitals, so where the hospital has been located. So it gives the feel good factor to the patients that he is going to one of the well-known clinic or a specialty clinic. And the right hand side here we have given the important contact numbers for a patient. So this is the dashboard for the patient wherein he can see his diagnosis event wise and the status, his medication details, his complaint details, and his allergies. To make it more user friendly, what we have done is the communication wherein patient can get the alerts for his appointment. He can receive the emails from the clinic for his treatment.
Okay, so the other parameter that we wanted to discuss today is about the integrated HIMS, or what we call as improved or efficient operations or efficient hospital setup. So here today we are now going to focus on how a proper HIMS, which is well designed, well structured, can help you improve the revenue or the efficiency of your setup or your facility. So what we have as a product is basically an integrated HIMS. Every department is interconnected. So when you have an appointment, the doctor has seen the appointment, gets SMS for the appointment. Similarly, when the doctor makes some changes, the patient is informed. Similarly, if there is an IPD to be informed, then before the patient arrives, the bed allocation has been taken care of, the billing department has been informed, the pharmacy has been informed. So all these departments are interconnected. So there is increased communication which helps in the operations of the hospital. And the main factor is coordinated care. So every person in the hospital is well informed about the patient, his well-being, his location in the entire premises. He's been taken for the operation, or he's under OT, he's under intensive care, or he's in the OPD. So all this, because each one on his screen is being informed that the patient is now here and he's being trackable, and then what is going on with his treatment. So there is coordinated care, which again gives a good impact to the patient, because whenever he's arriving, people know that he's being, they're well managed. The patients are well managed, being an integrated HIMS. So let's now take to I'll ask Prabhat to show you the application that we are talking about.
So this is what our application looks like here. What we have done is we have given the roles and rights based system, wherein as per the hospital processes you can assign the roles to the user and give the access. So this is what the dashboard looks like for the receptionist. So here I have logged in from the admin. So I have access to all the modules which are there in the integrated HIMS. So here you can see the list of the modules which are available. It starts with appointment. Appointment we have reception, we have doctor desk, we have e-prescription, we have IPD, nursing station, OT, LIS, RIS and billing. So along with this administration module, we have added a couple of add-on modules which takes care of the inventory. Pharmacy we have payroll and HR. Along with this we have financial accounting and report. So I will show you some of the features of the application. So here this is the receptionist dashboard, wherein on the left hand side you can see the calendar. So once you select the specialty and the doctors, you can see the appointments which are lined up for today. So here you can see there are 2 appointments which are lined up today for the consultation for Dr. Ghassan Abdul. So here we have given the color coding, wherein receptionist can see that the appointment which are shown in the yellow which are pending, green which are arrived at the clinic, green which are completed, and red which are cancelled. In the doctor's availability, here we have given the week-wise view of the doctor's availability at the hospital, where you can search the doctor by the specialty. In patient status, you can see the appointment which are not confirmed. So here you can see the appointment which are lined up for today. So once the patient has been walked into the clinic, you can confirm his appointment. Here we have given option so that you can send an SMS and email. Even you can postpone the appointments, and the online appointment will be shown in this tab, online appointments. Mr. Alato, I would request you to switch off your video. So once you're done with the appointment, we'll go for a reception, wherein reception can confirm the patient and register to the clinic. So here we have given functionality where you can search by his name, his mobile number. So here what we capture is the detailed demographic details of the patient along with his passport number. For some countries the patient's country code is required. So we have the functionality in application, we can do that. At the time of the registration, so these are the details will be captured, like if the patient has gone for insurance, we have a functionality where we can capture his front side and back side of the insurance card. If the patient is going for the IPD, we have the functionality where we can select the bed. And if the patient is follow-up, on the left hand side here you can see the details of these previous records. So let me show you how it looks like when the patient will go for a consultation. So this is what his EMR looks like. Here we have captured his history of his present illness along with the complaints and the details. His PFS history, present family history, which captures his allergy, his habits, and what the current medication he is going from. His clinical examination. Here we have defined the color coding and his diagnosis. Here we have given the ICD-10 code search, wherein doctor can search by the ICD-10. This is for a physician order wherein doctor wants to suggest any drug. He can search by the drug or his generic name. If you have already filled up the prescription, you can select, and once you select and click on the fill, it will automatically take the medicine and the drugs which are there for this specific prescription. If you want to suggest any investigation, you can suggest. I will show you how the IPD dashboard looks like. This is how IPD dashboard looks like. On the left hand side you have a view of the wards. As per the wards you can see the details like how many patients are admitted. I will show you how this is what the LIS dashboard looks like, wherein if you want to see, I will show you some of the old records so you'll get an idea. So this is a list of the tests which are suggested by the doctor. So here we have captured the details of his MRN details, his visit number, patient name, who is the consulting doctor is, the department and the test name. So here at the status you can see the multiple status which are like sample collected, requisition raised. So whenever you do the any transaction, like once the sample has been collected, once the barcode has been generated, so the status will automatically change. RIS. So wherein you can see the details, you can see the status which is dispatched. The patient name. So here in color coding you can see the requisition has been raised, the test has been completed, it has been approved by the doctor and it has been dispatched. For the RIS lab manager, here we have given the option he can view the details by day wise, week wise and month wise. So this is what is our fully HIMS is, which includes all the details about the day-to-day operations of the hospitals. So now we will start with the question and answer session.
Yes, Vinay, we saw the question. Yes. So the answer is yes, we have the capability to save and upload an X-ray or a report if it is directly available. In case of LIS, that is if there is an analyzer attached to the application, then the reports will be automatically generated from the device. And in case of X-ray machine, of course the X-ray will, the modality, a CT machine or an X-ray machine, it will first send the report or send the images to a PAC server, and from the PAC server they will be viewed in our application because we support DICOM viewer. So the answer is yes, we can see an X-ray or a report in the LIS. So anyone else with a question? We'd like to open this time for Q&A. Yes. Tell me, is it Saurabh?
Hello?
Can I? Yes. Can anybody hear me?
Yes, your voice is too low.
Hello?
Yes, Saurabh.
Can anybody hear me?
Yes, we can hear you. Please go ahead.
I literally watched the dashboard. I struggled to hear anything. My question is, will there be a recording that would be shared with us? Going forward, now I look at the screens and I think I like what I see.
Sorry.
Do you want me to repeat the question?
Yes, but is this Joe who's talking? I'm not getting the person who's giving me the question.
No, this is Aluki Adu from Accra.
Okay. Yes, Aluki. Yes, we will try to send you the recording. If you could please pass us your email ID on the chat, we will.
Okay. Okay.
Yes, I think Mr. Prabhat has already have your email ID, so we will try to give you the recording on that. But do you have any other question?
Great. Then going forward, how would I be able to have access to it once I'm interested? What's the way forward?
You are interested in the application, right? That's what I understand.
That's correct.
Yes.
Correct.
No, we will take it one-to-one on email, please. Today's
Okay, all right,
session
thank you.
is basically to understand what is needed in the market, to discuss what is available with us, so that if you have any more requirements, we can try to answer those also.
Great. My final question. Now, would your application be so intelligent enough that I would be able to integrate it to any other, if you like, provider or if you will, like insurance companies and other service providers, to be able to integrate with them and to be able to twig it once I have it and use it?
Okay, so basically what I understand is if you have another application, would our application be able to talk to it, or the question
That's
is
correct.
if you have an existing system, will we be able to work with that system? Is that the question?
That's correct. Or even would I be able to, would your application be able to communicate with other systems from
Yes.
elsewhere, which would include insurance companies and the likes?
Yes, the question, the answer of it would be yes, because basically any system would have a database, and what our system has, the patient database is its core. So if you want something more than the patient, so the patient demographics has to be captured in our system. But if you're talking about integrating to a finance system or integrating to a payroll system or even integrating to an inventory or pharmacy, it is very much doable. So the idea is that we should be able to, both the applications should be able to talk to each other, that is to be able to share data. And that is possible through what we call as web APIs. So our system is capable of using these web services to talk to other systems.
Great. Thank you.
Welcome. Yes, so do we have any more questions?
Yes, please. We have a number of questions. There are some icons on the dashboard that you haven't covered.
Yes, because the idea to explain today was how you can focus on how the patient would be comfortable, and the second area was how you could have an integrated HRMS to take care of the operations of the system. But again, if you are most welcome to call us again to go in depth in any particular module that you'd like to see.
All right, that would be okay. You stated that in South Africa this system has been in operation for close to 7 years. Are there any challenges that have come to your knowledge, which may be challenges that could affect us as well in Zambia?
Okay. I'm not very well aware, but this system that we have in South Africa, let me give you an idea about that one. That is basically a telemedicine system. So we have devices that are placed within some locations which are actually mine locations. So the owner of the mine, they have set up telemedicine centers in about 14 locations in Limpopo province. And the center, that what we call as Telemedicine Specialist Center, TSC, that sits in Johannesburg. So there what we've observed is basically because the entire project was handled by the telecommunication company itself, they had no issues in the connectivity. But in the other areas, wherever you would expect a telemedicine setup, the first thing that you should look up is whether you have good connectivity. Of course, there are options where you can say you can save locally and then transfer to the main server when it's connected, but that doesn't, justify the entire architecture of, distributed architecture or central architecture where you really want everything real time to be stored centrally. So to have that effect, you should make sure the connectivity is good. Second part is, for telemedicine especially, is the devices. Here the company we use is a Chinese company called Sunpa, who also had this government backing, and they were shortlisted from a number of companies, and most of their devices have been used. So you need to have good devices, telemedicine devices, so that they are set up well with the application. And the third part is to have a good system like our Lifeline telemedicine to be able to capture the details of the doctor, what we call as an EMR, electronic medical record. So these three factors is important for the successful part of telemedicine. Now if you talk about generally in the government or in the private sector in Africa, what I sense is that there may be a need of funds to be able to execute such projects.
The other question we have is, just like the other gentleman asked from Ghana, the issue of integration with the other systems, say an accounting system. Many times we are advised that the system can integrate, but at the point of implementation, that never works. In South Africa, there's a major system they are using, which is Search Pastel. How compatible is this system with the Search Pastel?
Sorry, could you write that on chat? How do you spell that?
All right, then I'll write that on chat.
Yes, please.
Then let me give my colleagues as well to ask you questions whilst you go through the message that I'll send on the chat.
Let me open the chat for you. You can do it here itself.
All right, I'm sending you the message via the chat, but my colleagues also want to ask you questions. They have a number of questions they want to get.
Hello?
Yes, yes.
The question is, what level of protection is this system having against hacking?
Sorry, come again, please.
What level of security against hacking?
Okay.
What type of protection is there?
Okay, what we understand is the application gets hosted on the SSL protocol, so which itself is a secure way of hosting an application. So that is one level of security. The second level is how you would like to have your data center placed. If you are on the cloud, then the cloud company is responsible for the security of your data and your application. If you are wanting to have it in your own premises, in which case we will install it for you in the location, then you are responsible to make sure that all the required virus scans, bugs, the installations, the latest versions of all the applications are installed. And in terms of backup, we do recommend DR and DC systems. So that is the data center would have your application, and the DR, that is the data recovery center, would have a backup of your entire DC. But again, this is all as per design by your network administrator. What we provide you is the application to host.
Yes, we have another question. You did mention during the presentation that patients are able to get SMSs to remind them about their appointment.
Yeah.
I'm just wondering, do we have the same facility for doctors, especially when results for patients are ready? They get alert messages.
Yes. Yes, the system is capable of generating alerts at any of the process wherever it is pretty much configurable. So if you require him to get an alert when there is a appointment cancellation, he will get one. When there is a prescription, he can get a copy of the prescription. Or even when the patient wants to talk to him, he can get an alert. So it basically depends where you want him to get an alert, but the system provides you the facility to send an SMS and an email. Did I answer your question?
We have noticed this system is web-based. Where will the servers be based? Are they going to be on the site or they'll be with you?
We have the choice with the vendor, we have the choice with the client. We can, if you are aware of any company that would host the application, that is any space on cloud, you can give us the credentials and we will host the application there. If not, if you want the entire web server to be in your premises, within your LAN, we can install it there. So we are open to any kind of implementation.
So how soon can we go through the other options that we haven't looked at? Because I think those others are critical, especially the finance, the inventory management. We have seen there's a payroll there.
Yes, there is a payroll also. So, sure, Vincent, I think Prabhat will get back to you on that. We will let us schedule a demo as many people are coming back with this requirement. We will surely give you a slot and send you an email about it.
And how is your support? Do you have a representative in South Africa handling this region? Or people have to contact you in India?
We do have a local partner. We do have Telemedicine Africa as a local partner. But what we also have is a CRM system where it's 24/7. It's a ticketing system, and you can raise a ticket of 4 types. It can be a customization, it can be a bug, or it can be even a training request, or even explanation about some functionality. So these kind of tickets can be raised, and as soon as a ticket is raised, it is allocated to the right person, and within a fixed ETA, which means a time allocated for that kind of ticket, you will receive the reply and you will get the solution for the ticket. So even if it's a training program, you can arrange that through the ticketing system or through the CRM that we talk about. We have about 15 sites internationally where we are supporting through the CRM. So these are out of India, talking about international locations.
All right. Are you able to share with us how much this could cost?
Yes.
Or maybe you can explain him.
The of these products and all will depend on a number of factors. Basically, it depends on the number of users to be trained, the location of the site, the hospital size in terms of beds, number of users, and even the module requirements. Like some of them may already have a finance in place and they want to be integrated, and or they may have an RIS and they would need a server. So these kind of requirements will define the cost of the product and the support, of course. If you're looking for the one MC and what kind of training periods you would like, so all that we will define once we start talking to you. So we can take up that one-to-one with Prabhat and the rest of the team, our sales team. Is that fine?
I think from our end that's so. We'll wait for you to give us the next timetable so that we can go through the other icons that we haven't covered.
Mr. Vincent, Prabhat here. If you can let me know, as you have my email address, you can check with your team and you can let us know your convenient time schedule, maybe around for 1.5 hours to have the detailed demonstration, so that we can plan it accordingly.
All right.
Yeah? Okay.
Annalyn, I think there was a question from you about data privacy. So basically this data that we're talking about, I assume it is patient data, both demography and clinical, and which is of course has to be really secured or very confidential. So this data always lies with the hospital, and the hospital authority has to make sure that their administrative rights are reserved for the right authority. Similarly, at every level, even if it's about a concession on a bill or if it's about taking a particular treatment step in the EMR, the doctor wanting to give him another kind of a medical dose, at each level you can make sure that there is an authority who approves. So in that way, it is made sure that only the authorized people are responsible for the data. Similarly, we have audit trail maintained in the system, so that each transaction that happens, whether it's a bill or whether it's a patient walking in, it's registration, every step is being logged. Which user made that transaction. So that is the way we ensure the security or the privacy of the data there. We do have a queue management system. Again, there are two ways of the queue management system. You can have a hardware system where you're getting a ticket or a kind of a kiosk where you get a ticket or token out of the kiosk token machine, and then you have this number that gets registered in the OPD screen. The other method is the only software, so you basically have a TV placed and the OPD screens are then updated to show on the TV. So yes, we are capable of integrating with the hardware also, and we are capable of giving you the software solution also. We have 2 locations right now who are using our queue management system. But as you may understand, we do not own the hardware. We would request that if you are aware of any hardware used for queue token machine, you are most welcome to introduce, and we will try to integrate our systems to that hardware. Okay, thank you. Yes, so do we have any more questions? I think we've just finished on our time today, but I can take in any last question.
On the chat, we sent you a question, you haven't attended to it yet.
Okay, is that Vincent? From Vincent?
Yes.
Okay, so the question is whether we are integrating to stage systems. Is this an HMI system on its own? Sorry, I'm not aware of this.
What system is an accounting system?
Okay. Sure, let me get back to you on that, because I think Prabhat can answer that on email. I need to check with my technical team, because we'll need to get the details of this system and try to see. But overall, I can answer that we are capable of posting all the transactions into another finance system if required. In India, we use a system called Tally. So there are many doctors who are already comfortable on Tally, and then they use our system and make sure all the transactions are posted into Tally to get the final accounting system. So yes, we are capable of integrating to accounting system. And your concern that the fact that many vendors do say that it is compatible, but during implementation they will not. We will make sure that during our gap analysis, which is the first step that we do when we start engaging with the customer, during the gap analysis we will make sure that we've understood both sides of the application. The application technical team will give you a time frame as to if it is possible to be integrated or not. So we can then decide whether you would like to go ahead with us or not. So let's keep these things for later when we get to discuss one-to-one ahead of this. But as far as this webinar is concerned, I hope we have answered most of the questions, and that it has benefited all of you, whoever has attended this. So we will hope that we will have more webinars, and we will be able to engage all of you again in another session. So thank you everyone.